Hi, I hope you all are doing good. And the recent question that keeps popping in my mind is about the vegetarians with CKD. We come up with so many patients asking for, should we stop protein completely? Should we restrict eating dals, which is the key food for a lot of vegetarians? And should we not, should we stop completely all the dairy products? Or should we turn vegan and restrict pulses again? So, for our experience and understanding that we at Sufala Care are going through, is that 90% of the time, the required protein intake, even in normal individuals in India, is very, very poor. Suppose somebody weighing around 60 kgs is not even reaching around 40 grams of protein in their regular consumption, while requirement is 1 gram per kg body weight. So when we are talking of the shortage of protein intake itself, if the condition is showing up that you have protein loss in urine, you have raised creatinine, your renal function is getting affected, your EGFR is low. So all this means that you had certain associated chronic conditions which have caused this, and not exactly the food that you have been taking. Also remember that just because you have a protein restriction does not mean that that suffices and cures your condition. Your body still requires a good amount of protein for bodily functions and physiology. So you require maybe a lesser grams of protein, like we would usually calculate for 0.6 or 0.8 per kg gram weight of protein for individuals who have protein loss. But that does not mean vegetarians should stop eating pulses. Now, the best way to eat your pulses is you start soaking the pulses 3 to 4 hours prior to cooking. When you decide that, suppose you have it in the afternoon, soak them by 10, 11 in the morning, and by 1 o'clock, the pulse is soaked well. Wash it thoroughly, always buy unpolished, organic sourced pulses. Wash it thoroughly. In an open pan, cook it with plenty of water. And by 10-15 minutes, you will see that water is bubbling and there is a froth forming on top. Just discard this water completely. Add fresh water again. Rinse it once. Add a couple of cups of water. Suppose it is 1 cup of dal, you add 2 cups of water more. And now you can give it on a pressure cooking. And this dal is ready for consumption. Free of phytates, saponins, external chemical coatings that would have, though we talk of organic, we do not know what is the most authentic source of organic food. So we have to be ultra careful, especially with CKD folks, that we are using chemical free foods in consumption so that there is lesser pressure on the kidneys. So typically wash it thoroughly, then pressure cook it. This dal is completely absorbed and the protein quality is best retained. Nothing you are going to lose apart from some amount of nutrients that are going to get converted into uric acid in the body, that is the phytates and saponins. So the best way is to cook dal this following this method. Secondly, if you are gassy, you have acid issues, or you feel bloated after eating dals, remember to add a pinch of asafoetida or hing, a pinch of turmeric, and a small 1-inch piece of grated ginger while you are pressure cooking your dal, and all your stomach issues will be resolved. Same time, this will also help in improving your gut health. So go ahead, eat your dals bindas without any fear or guilt, and you are going to have 2 servings of dal in your lunch and in your dinner. You can reduce the quantity of rice or wheat, but dals, vegetables and salads, have them in plenty, irrespective of your CKD condition. I hope this helps most of you, especially the vegetarians, and start eating your food happily. Take care. All the best. Stay in pink of health. Bye-bye.